Welcome back, my faithful subscribers and those who are new here. So glad you could join us. Today we will delve into the subject of Prostate Cancer Awareness Month. Do you know what the most common cancer in men is? That's right, it's prostate cancer. More than 52,000 men are diagnosed with prostate cancer every year on average. That's 144 men every day. Every 45 minutes, one man dies from prostate cancer. That's more than 12,000 men every year. 1 in 8 men will be diagnosed with prostate cancer in their lifetime. This prevalent disease originates in the prostate gland, a critical part of the male reproductive system. The prostate is a small but mighty organ, and when cells in this gland begin to grow out of control, prostate cancer is the result. Now, while the word cancer may understandably set off alarm bells, it's essential to note that prostate cancer tends to grow more slowly than other forms of cancer. This slower growth provides a silver lining of sorts. It allows for a variety of treatment options. The choice of treatment isn't just about the cancer itself, but also factors in the patient's overall health, medical history, and personal preferences. From active surveillance to surgical procedures, radiation therapy, hormone therapy, and even immunotherapy, the options are many. Understanding these treatments is vital for those diagnosed and their loved ones, ensuring informed decisions that align with their health, history, and preferences. What do we really know about prostate cancer? Well, it's not as straightforward as it may seem. Prostate cancer, a disease that starts its journey in the prostate gland, is a complex character. One of its most distinctive traits is its variability in aggression. Some cases are like the hare, quick and aggressive, while others are more like the tortoise, slow and steady. The treatment plan for this disease is not akin to picking a suit off the rack. There's no one-size-fits-all solution. It's a tailored process that takes into account several factors. These include the grade and stage of the cancer, acting as the blueprint for the treatment strategy. But there's more to it than just the disease itself. The overall health and medical history of the patient also play significant roles. Even personal considerations like age and values hold weight in this decision-making process. What does active surveillance mean in terms of prostate cancer treatment? Let's dive into this. Active surveillance is a strategic choice for men whose prostate cancer is deemed low risk. Instead of immediately opting for aggressive treatment, this approach prioritizes regular monitoring to keep a close eye on the disease. Active surveillance involves routine checkups, including digital rectal exams and PSA blood tests. Now, you might wonder, what's a PSA blood test? It's a test that measures the level of prostate-specific antigens in the blood. These levels tend to rise in cases of prostate cancer, making it a useful tool in monitoring the disease. In addition to these, biopsies may also be performed. A biopsy is a procedure where a small sample of prostate tissue is removed and examined for signs of cancer. The goal here is to closely watch for any signs of cancer progression. Active surveillance is a cautious approach, closely monitoring for any signs of cancer progression. What if the cancer needs more aggressive treatment? Well, let's delve into 2 procedures that can be employed: prostatectomy and radiation therapy. Prostatectomy is the surgical removal of the prostate gland. This procedure is typically used when the cancer is localized, that is, it hasn't spread beyond the prostate. The goal here is to remove the cancerous tissue entirely, offering a potential cure. Now, you might be wondering, what about the cancer cells that may have already spread? That's a valid concern and is precisely why doctors often recommend radiation therapy in addition to, or sometimes instead of, prostatectomy. Radiation therapy uses high-energy rays to target and kill cancer cells. Think of it as a sniper, taking down the enemy cells from a distance. But not all radiation therapies are the same. There are 2 primary types: external beam radiation and brachytherapy. External beam radiation directs radiation at the prostate from outside the body. It's a bit like getting an X-ray, but with a higher dose of radiation. The treatment is typically administered over several weeks to ensure the cancer cells are adequately targeted while minimizing damage to healthy tissue. On the other hand, brachytherapy involves placing radioactive materials directly into or near the tumor. It's a more localized form of radiation therapy, delivering a high dose of radiation to the cancer cells while reducing exposure to surrounding healthy tissues. Brachytherapy can be done in 2 ways, either by temporarily inserting radioactive seeds into the prostate or by permanently implanting them. The choice between these 2 methods depends on the specifics of the cancer and the patient's overall health. Both prostatectomy and radiation therapy aim to eradicate the cancerous tissue. Prostatectomy seeks to remove the problem at its source, while radiation therapy targets the rogue cells, whether they're in the prostate or have started to make their way elsewhere. These treatments are different approaches to the same goal, halting the spread of cancer and restoring health. Each has its benefits and challenges, and the choice between them is a decision made in close consultation with healthcare providers. What if surgery or radiation isn't enough? This question brings us to the exploration of additional treatment options for prostate cancer: hormone therapy and immunotherapy. Let's start with hormone therapy. This treatment strategy works by tampering with the body's hormone production, or by blocking the action of hormones on the prostate. Why hormones, you may ask? Well, prostate cancer cells depend on hormones to grow and multiply. By altering hormone levels, we can effectively starve the cancer cells and inhibit their growth. Hormone therapy can be administered in two ways. The first is through medication that stops the body from producing certain hormones, effectively reducing the amount available to fuel the cancer cells. The second method involves medications that block the action of hormones on the prostate, preventing them from stimulating cancer cell proliferation. Now, let's switch gears and talk about immunotherapy, also known as immuno-oncology. This treatment approach capitalizes on our body's natural defense system, the immune system, to combat cancer. The concept is simple yet powerful. Boost the immune system's ability to recognize and attack prostate cancer cells. Immunotherapy techniques can vary. Some methods involve modifying immune cells in a lab to make them more adept at fighting cancer. Once these enhanced cells are reintroduced into the body, they work by seeking out and destroying the cancer cells. Other techniques employ vaccines that activate the immune system against cancer cells, much like how a flu shot primes our body to fight off the influenza virus. In the grand scheme of prostate cancer treatment, hormone therapy and immunotherapy offer promising avenues for combating this disease. They may be used in conjunction with other treatments, or as standalone therapies, depending on the specifics of the individual case. The takeaway here is that there's no one-size-fits-all answer to treating prostate cancer. It's a tailored process, underpinned by scientific advancements and guided by the patient's unique circumstances. Hormone therapy and immunotherapy are powerful tools in the arsenal against prostate cancer. And with continued research and innovation, we're getting closer to turning the tide on this common disease. So what's the best way to tackle prostate cancer? The answer to this question is as unique as the individual asking it. The journey through prostate cancer treatment is deeply personal. There's no one-size-fits-all solution, but there's a roadmap to finding the best approach for you. The key lies in personalized treatment plans. They hinge on an active dialogue with healthcare providers, a thorough understanding of available options, and a careful consideration of your health, history, and personal values. It's about tailoring the treatment to your specific needs, not just the diagnosis. Adherence to prescribed treatment plans is just as crucial. It's essential to communicate openly about any side effects or concerns. Remember, your healthcare team is your ally in this journey. They're there to help manage side effects, maintain your quality of life, and answer any questions you may have. By understanding the available treatments and engaging in informed discussions with doctors, patients, and their families, can navigate the complexities of prostate cancer with confidence and clarity. Thank you for joining us on this comprehensive journey through understanding prostate cancer. We hope this video has empowered you. If you found this content helpful, please don't hesitate to share it with someone else who might need it. You never know whose life you could be changing. And remember, your journey doesn't stop here. Subscribe to our channel for more insightful health-related content. We're committed to bringing you the most accurate and up-to-date information to help you make informed decisions about your health. However, this video should not replace a consultation with your healthcare provider. Always consult with them for any health concerns and before making any decisions about your health. Stay informed, stay healthy. Don't forget to watch our other medical videos for health insights. Let's continue to navigate the complexities of health together. Until next time, everyone, goodbye.